Hey, thanks for joining me today. My name is Scott Clausen. This is For the Love of Medicine. Today we're going to be talking about delirium, particularly in the ICU patients. So hopefully you enjoyed the video. We're going to be talking about what delirium is, why we should care about delirium, how to spot it, and then what to do once we know that we have a patient in this status. So hopefully this helps you on your road to medicine. We're going to be sharing more videos, so please click the subscribe button below and we'll have a good journey together. Thank you. Okay, so let's talk a little bit about ICU delirium. So first of all, let's kind of pinpoint what this means, what delirium is. If you look it up in the dictionary, it'll talk about hallucinations, it'll talk about loss of mental status, just not knowing where you are, you're just forgetting a lot of things. So in the ICU, they don't necessarily need to be hallucinating in order to be delirious. So what we're talking about in the acute phase is an altered mental state, loss of executive functions, reduced cognitive ability, not really being able to orient themselves to where they are. You might be talking to them and they'll be nodding, they'll be agreeing with you, and then within seconds they're forgetting completely what you said. But the big question is, as a clinician, why should I care? So we all know that high brain function is very important and necessary for keeping our lives running in a healthy way. And this is even more so when we're sick. We need our brains to be running at optimal conditions and its optimal level in order for us to get better. Okay. The second reason we should care is that as clinicians, we are charged to do no harm, to do what's best for the patient overall. So the longer these patients are sedated, the longer they're confused, disoriented, they don't know where they are, they don't know who they are or why they're there, the longer that they're not able to carry on a conversation, this all takes a toll on their overall mental status, and later on down the road, they're not going to be as able to function in regular life and may not even ever get to the point that they were at before they came to the ICU. So a lot of you are saying, well, that's fine, I'm saving their life, so some injury later is understandable when you save their life. True, but we need to do the best we can to make sure that these patients are as healthy as possible. So a big question is, how do I spot delirium? Because we have medications, we have different drug pathologies that are going to cause things that look like delirium. So how can you tell? So let me talk about a patient that we've had. I'll call him John. He had a burn and it went untreated, and he came in with burn septic shock. And he was intubated. He stayed on the ventilator for a very long time. Now this patient became ventilator dependent. He was a very hard wean to get off the ventilator, off the sedation. He was combative when he was coming out of sedation, and so there was just a long process of him being on the unit. We sent him to a step-down unit. He was having his breakfast and sucked down some eggs. He was still trached and just wasn't cognitively there, and so he's coded multiple times, and he's been here for a very long time. And so this patient, you talk to him one day and he remembers his favorite songs, he could talk to you, he usually remember your face, but there's just some things that cognitively he's not able to do anymore. He'll ask for rehab to come take him to the gym, and you'll tell him that they're on their way, or you'll tell him that they'll be there at 2 o'clock, and he'll ask you over and over and over again, kind of like a patient with dementia would. So this patient is a pretty good example of how this delirium, prolonged, has caused an early onset of worsened dementia than he probably would have had he not been in the ICU. The biggest thing for us to do is to really diagnose where the delirium is coming from, to understand, is there something we can do about it? Is there drugs that I'm giving them that they don't need? Is there a disease process that's attacking them that we need to treat? But one of the biggest things is change their environment. They're stuck in a bed in a hospital in an ICU. They haven't been outside, they haven't been able to walk around much. So early mobilization, getting their family involved. So if there's family in the scene, my example with John, his family wasn't really able to be here much, and that's what made situations worse. But if family can be involved, that will make their situation much better. Being able to get that interaction with someone that they know. Also, if they wear glasses, put their glasses on them. If they like to read, bring them books so they can read, or have their family bring in some of their favorite books. If they have a hearing impairment, make sure they get their hearing aid. Do whatever is possible to get them feeling comfortable in the ICU so they can get their cognitive ability back as early as possible. Now, if you're going to the doctor soon, maybe in for a surgery, maybe you're found this video because you're worried about this, talk to your doctor about delirium. Talk to about the possibilities of being in the ICU. And talk about what you can do beforehand or what you can line up with your family to make sure that you're not alone, and make sure that you're getting the help that you need to get out of the hospital with your best mental status you can. There's been cases of people that 10 years down the road, they still aren't back to it. They've gone from job to job, they tried to do what they did before. So really this is important. This is taking care of our patients, making sure we're not causing unnecessary harm to our patients, and most importantly, it's about being good to people and giving them the best chance they have, not only to survive, but to live after their encounter with the ICU. So I hope this helps. Comment below. Please click the subscribe button so you can help me in my journey as I'm sharing these videos, as I'm sharing the things that I'm learning in the ICU and in my clinical experience. And hopefully we have a good journey ahead of us. Thank you.